The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
Welcome to the Senior Show with co-host Neil Himmelstein, radio host of the Main Street Code for Financial Success, and Tim Kennedy from Movement Mortgage. Unfortunately, Tim can't be with us tonight, but we have a wonderful guest with us, Bob Falkowitz. Bob Falkowitz from Senior Care. Bob, what's the name of your firm again?
Senior Care Consultants.
From Senior Care Consultants. Thank you, Bob. I'm glad to have you on. Bob is an expert in the area of Medicare, and, you know, with this changing environment, we want to really talk about some of the changes going on with Medicare and why, you know, that you need to be aware of when you're selecting what type of plan you want and what type of care you want. So, Bob, take it away.
So basically, we're going to talk about how, when and if you are turning 65, how to navigate with the Medicare puzzle, when to enroll, what are the letters, the Medicare letters A, B, C, D stand for, can you enroll in Medicare if you're under 65, what are the health conditions that allow you to do that, or if you're on Social Security disability, can you sign up for Medicare? So I think, Neil, I'm just doing an overview where you want me to start with Medicare, explain the letters, or, you know...
I really want to talk about maybe some of the differences between, you know, we hear a lot about these Medicare Advantage plans and we hear about these Medicare Supplement plans. Why don't you kind of go into what the difference is and why you might do one and why you might do another, and really some of the changing landscape in Medicare. You know, carriers leave, carriers move forward. I mean, so I know there's a lot of, it's always changing. And I just want you to get into some of those areas. Well,
let me just stop and say the biggest change in Medicare, which was started last year, is on the prescription drug side. So anyone who has a standalone prescription drug plan, they've seen their premiums really go high. There's a lot of the carriers have increased their premiums. Reason being that if you're out-of-pocket copay and costs, come up to more than $2,100 for the year, at that point it becomes 100% carrier, so you're not paying any more for copays. I think most people listening to this remember in the prescription drug world there was the basic amount, and then there was the donut hole, and then the catastrophic, and all these different tiers had a big impact of that, how much your copays would be. Here it's very cut and dry. But once you're either on a generic drug or a preferred brand drug, and you pay your co-pays, and again, this year the annual deductible for prescription drug is $615, and once you accumulate $2,100 in costs, co-pays and deductible, then it becomes 100% carrier. So that's the big change right now in Medicare. The difference between traditional Medicare, Medicare Advantage plan, is something to really dive into. With traditional Medicare, you're prepaying to have the excellent coverage in front of you. Having your A and B Medicare card, A is for the hospital side of Medicare, your stay in the hospital, and the B side of Medicare is everything else, doctor office visits, x-rays, laboratory, physical therapy, and a whole host of other service areas. The Part A Medicare, as long as you worked 40 quarters or 10 years, you paid into the Medicare system on your Medicare payroll tax. The Medicare Part B, that kicks in once you apply for Medicare, and that's based on your household income, and the lowest amount on the chart for a single or married couple is based on household income. Obviously, people who earn below $218,000 as a couple, their cost for Medicare Part B this year would be $206.50. And the scale goes up. So the highest end of people who earn over $750,000 a year, their cost for Medicare Part B would be $792 a month, plus what they call an earned tax adjusted related adjusted income, and it does increase your monthly cost for Medicare Part B.
Yeah, but Bob, what I really want to know from you today is what's the difference if I buy a supplement Medicare Advantage plan or a Medicare Supplement? What's the difference?
So here is the difference. What I said before about cost savings So with Medicare, you're prepaying to have excellent coverage. So you're paying for your Medicare, which everyone pays for their Medicare A and B. It doesn't matter if you're taking traditional Medicare or a Medicare Advantage plan. But now you're going to have an additional cost for supplemental insurance to pick up those costs of a hospital admission fee, which this year is $1,736, and the balance billing that Medicare allows doctors to bill at the 20%. So it'll be at your out-of-pocket cost, but with a supplemental plan that pays that. Supplemental plans can be as high as $370 a month in the New York arena and less, but that's the high end. And then you're going to also buy standalone prescription drug plan coverage. With a Medicare Advantage plan, you do not need to buy a supplemental. The Medicare Advantage plan is Medicare giving Medicare to the private insurance carriers, and most of them it's on the HMO or Health Maintenance Organization platform. So it's not as many doctors that are in the regular Medicare network.
So they have to be in that network. So, for instance, if you're in Suffolk County, you have Stony Brook system, you have Northwell system, you have Langone system, you have 3 different hospital systems right here, and 4 if you consider the Catholic system, so it's a whole nother system, and your doctors may or may not be in multiple systems, or usually they're in one system or another, correct?
Correct.
Okay. So the Advantage plan, the way I see it, you're somewhat restricted to that network of doctors if you want full coverage.
Well, true in that, you want your doctors to be in that network so your out-of-pocket costs will be less, especially if you're just on an HMO plan. Some of the carriers do offer what they call PPO plans, which you can see a doctor outside the network as long as they're a Medicare doctor, and your copay, coinsurance, everything's going to be much more. But you still have that coverage on a PPO plan, which can cost you extra money. Most Medicare Advantage plans are zero-cost premium. That whatever you pay for your Medicare Part B, that is that. They contract with the government how to be reimbursed. So they become your Medicare provider. But here's and you don't need, as I said, to buy prescription drug and supplemental, because in those plans are drug coverage, and you don't need supplemental.
So for a lot of people, it's a great option. It's a low-cost option. Of course, you do have copays, but it's a much better low-cost option for people. However, on the downside, that insurance company really decides what procedures that you can do and whatnot, correct?
Well, and they don't decide. They could say to the doctor, they want pre-authorization on a position. So a doctor writes an order and say, okay, Neil, you need this knee replacement. And the carrier could come back, well, we don't see it medically necessary. So now the doctor has to give their reasons as to why. And the carrier could still say yay or nay to the request.
Right.
So there's that. When it comes to regular Medicare, the only time Medicare questions the doctor is if it has to do with cosmetic surgery.
What if you're out of state or you're traveling, or how do the Advantage plans work?
Well, then for true emergencies anywhere in the country, no matter what insurance carrier you have, you're covered on a true emergency through emergency room. God forbid you have a heart attack, you're in California or from New York, you walk in through the emergency room, and if that's your condition, you are covered. But basically, if you're traveling and you want to see private doctors in that city, that town, you do not have that coverage. On Advantage plans, it's more domiciled to where you live. Yes, there are carriers that spread through the countries in different states, but the one that goes through all 50 states is regular Medicare. So if you're traveling and you get sick in Arizona and you need to see an eye doctor, you just call up local, I need an eye doctor. He asks you to take Medicare, you go. With a Medicare Advantage plan, you have to make sure that doctor is in that Aetna or United Healthcare network before you see the person.
Right. Okay. And now the supplement plans, you pay more for up front, but they give you more options as to where to go and what to go.
Well, they're not your provider, medical provider. Medicare is your medical provider. What they are, look at that as like the major medical. They're the secondary payer.
Okay.
So they pick up your admission fee to a hospital. They pick up that 20% balance billing. It picks up the annual deductible from Part B Medicare. So it's picking up a cost that you would normally have if you did not have a supplemental plan.
Gotcha.
And people understand, like a Medicare Advantage plan is basically a platform and continuation of group health insurance. Because basically you just go and you pay your co-pays, you know what your co-pays are, and if there's any co-insurance.
Got it. So listen, you're listening to the Main Street you're listening to the Senior Show, and we're here with Bob Falkowitz. And Bob, what's the best way to get a hold of you for your Medicare questions?
Sure. Phone number is 516-220-7849. Email address is bob@seniorcareconsultant.net. No S, just seniorcareconsultant.net.
And you can visit me at 631-647-4694. I don't have Tim Kennedy's number right now, but Tim is our co-host with Movement Mortgage, and we'll be right back after a quick break. Thank you. Welcome back to the Senior Show. I'm here with Bob Falkowitz, a Medicare insurance expert and a senior advocate, as I am, and he's been talking about Medicare and Medicare supplements and Advantage plans and all this stuff. And there's this assumption out there that it covers a lot of things. Bob, I want to know some of the things Medicare doesn't cover. So
if you're on right, if you're on traditional Medicare, it does not cover dental services and vision. Not eye doctor, but vision. Eyeglasses, contacts, things like that. So there are things that Medicare does not cover. Plus, for the Medicare Advantage plans, they do cover and give some dental, vision, and even meals at home after a hospital stay. Some even give you transportation to seeing your doctor. So there is a difference between that and an Advantage plan. And Medicare also, people confuse, which Neil, Medicaid with Medicare. So Medicare is the U.S. government program, all right, where Medicaid is basically domiciled per state and organized through state by state. Medicare, and Medicaid coordinate with each other, but you have to be impoverished most often to get on to Medicaid.
Right?
And, I mean, you could run with that, explain more if you'd like, but, and another thing that the Medicare does not pay for is extended long-term care in any nursing facility, okay? It's only for rehabilitation services that Medicaid does pay for, and even that's, the max is 100 days. But as far as home care services or a nursing facility, Medicare does not pay for that.
And
whereas
it's right on the application. It says, we do not cover this.
Right.
And people don't understand that. They say, oh, I'm covered. And the problem is you're left naked if you need some sort of long-term care. If you need care at the home or the time at the rehab center runs out, pretty much you're on your own, unless you have some other type of insurance, correct?
Right. That's where long-term care would kick in. And then there's, there's elder care attorneys that help you figure out how to see if you can get Medicaid to help you with the cost of long-term nursing home costs.
Unless you have long-term care insurance or some sort of insurance plan that can help cover that and fill that gap. You see, everything is, when you're doing your planning, Bob and I have been around a long time, in fact, in this insurance business. And what we do is we try and protect all those gaps in your plan, because you can't tell the what if. That's the problem. You don't know the what if today. Everything's going great, and then what if this happens? Where are you protected? So we can tell you what if you don't do something, what will happen, because we have that experience. We know, we have that crystal ball, right? We've been in it long enough. You deal with enough people and you realize, what's the what if factor? Well, one of the what if factors is you or your spouse are going to need some sort of care, whether it's in your home or in a facility. It's inevitable. As a matter of fact, percentage-wise, over 70% of people, that's more than 2 out of 3, will need some sort of care. And if you're a couple, it's almost 90% that one of you will need care. And that type of care is, I can't perform 2 activities of daily living, such as bathing, dressing, driving. These are very important areas of our lifestyle that all of a sudden are taken away from us. So we talk a lot about this because we see it every day. We have clients that, they went into a rehab center and, covered the first 90 days and then actually covered some of the last 10 days, the 100 days. And then the bills come in, $600 a day, $20,000 a month, $18,000 a month. Now, if you're wealthy and you say, I'm going to self-insure, great. Take all your assets and give it to these facilities. Okay? Because that's what's going to happen. Now, conversely, you want to stay home. And what's a logical thing? Bob, if you stay home, who's going to help you at home?
You need a caregiver. You need a caretaker. And
well, how about your wife or your kids?
That's right. You put it on your wife and your children, but they have to go to work, the children. Your wife, and it's very demanding, especially if it's a 24/7 situation. How much could the spouse do?
Right.
And this is, spouses do work things out together, but it becomes very overwhelming to be a caregiver.
Right. Now, in my situation, my mother was the caregiver for my dad. My dad, very successful guy, he's a veterinarian, did very well. He had disintegrated discs in his neck and his back and osteoporosis, and to the point where he was wheelchair bound, even though he's an athlete his whole life. Great tennis player, played tennis from the time he was 20 till about 62. He played every day. He played outdoor, he played indoor. He was a semi-pro soccer player as well as being a veterinarian, but his body did not hold up, and my mom ended up having to push him in a wheelchair. But it was more than pushing in a wheelchair. Getting out of the bathtub was the most difficult thing. And back then, they didn't have long-term care programs. But so what did my mother do? She couldn't get him out of the bathtub. She called 911. Okay? They came 45 minutes later while he's sitting in the bathtub because she couldn't lift him out of the bathtub.
Right.
This is something that you think that, I'll self-insure, I'll do this, and my father was that way, but we didn't have the insurance back then. But he had some money, but I'll self-insure, whatever. And all of a sudden she calls 911. Well, a week later it happens again. Now they took 2 hours to get there. So she had to cover him up and, get blankets, whatever, drain the tub. This is real world stuff. Getting out of the tub is probably the most difficult thing in the world to do if you have a bad back. Let's face it.
Right.
But relying on my mother, who was getting older and older, she couldn't lift him, or she would try. And then, believe it or not, she was 7 years younger. She died 7 years before my dad. The wear and tear on her taking care of him is what eventually
took her down.
Make her pass away.
Right.
It's very upsetting.
It's very hard when you see a caregiver, especially the spouse, and it's 24/7. You see how their lives change, and they
right. Now we have friends. We have friends that I'm going to rely on my kids. Well, all of a sudden our kids have children, and they have families, and let's take them away from their family to take care of me, or let me move into their house and be a burden on them. Nobody really wants to be a burden on other people, unless you're just selfish and greedy. There's ways to protect that with getting long-term care coverage in combination to having the proper Medicare planning. You need proper long-term care planning, whether it's through insurance or through legal matters like Bob mentioned, to get you onto Medicaid. But when they get you on Medicaid, these elder law attorneys, all they're doing is showing you ways to impoverish yourself so that you can rely on the government to give them the type of care that they're willing to pay for. Not that you want, not that you're going to go to a place that you want or do what you want, what they're willing to pay for when you get on Medicaid. So you can drain your assets. Emotionally and financially can be a burden, and we want to help you prepare for that. We are running out of time, Bob. I'm sorry, Bob. What's the best way of getting a hold of you? Let us know.
Again, phone number is 516-220-7849. Email address is bob@seniorcareconsultant.net.
Fantastic. And you've been listening to Neil Himmelstein. My friend Tim Kennedy could not make it today. He's with Movement Mortgage. He takes care of your home as an asset and helps you with finding ways to get the equity out of your home. And you want to speak to me, Neil Himmelstein. I'm at 631-647-4694. Have a great evening, everyone. Thank you.